a Republican from Tennessee, but more important, he's a former emergency room physician, so he knows of what he speaks. Congressman, very good to have you. Are you relieved now?
Thanks, Neil. Yeah, I'm glad that it's done. I mean, we needed to get this package out to, our small businesses mostly, but of course the relief to our hospitals. And as you mentioned, I'm a former ER physician. That's the tip of the spear, so to speak, in this fight. So glad it's done.
Yeah. How will hospitals, physicians, nurses, those on the front lines, how will they be impacted by this? How will they be benefiting, and how soon?
Well, obviously it hits them immediately in terms of purchasing, cash flowing. One of the things that people don't realize is we've told people to shelter in place, the volume to medical facilities, for example, the ERs, is significantly down. So their cash flow is down too. Now, they haven't been closed, but the hospitals that do elective surgeries. So this is a cash flow hit to help them replenish their PPE stocks, hire extra staff and get people in there to cover the increased demand when there is for the COVID virus. And in New York, we're seeing that now where, they're setting up secondary emergency departments right outside the hospitals. So,
on that and the bed shortage or the feared bed shortage, particularly places like New York would still account for about half the cases, Congressman, in the United States. What do you think about that, retrofitting everything from the Javits Center in New York, using hotel rooms in other cities to prepare for many, many more patients with this virus?
Sure. Obviously, the mathematical modeling is evolving over time. So we started out using China's data, and that has proven to not necessarily be as accurate as reality, right? So those curves are changing, and the mathematical modeling is changing every day. Will we need all of this plus up? I don't know. Probably not. Hopefully not. But it's always good to be ready just in case. And New York is preparing for the worst case scenario, and we can't blame them for that. But again, the mathematical modeling, as Dr. Brick said yesterday, is changing, and that means maybe we are a little bit overprepared in New York.
As an emergency room physician by training and given your ample medical background and pedigree, Congressman, what are your thoughts on this push to try to unwind from stay-at-home provisions and others, maybe as soon as Easter a couple of weeks from now? How do you feel about that?
Sure. I agree with the president that it probably needs to be done at the state and local level. He's made that comment recently, and I agree with that, because the curve in Nashville and Tennessee is significantly different than the curve in New York City. And clearly they're going to get through the curve faster than we are. And we, of course, instituted, the social distancing before, earlier in the curve for us. So the flattening of the curve is going to be a lot better in Tennessee than it is in New York. So I think it really needs to be regionally dependent, and I agree with the president on that.
All right. Dr. Congressman, thank you very, very much. I do appreciate it. I know
Thanks, Neil. Thanks for being patient.